Hi, everyone. I'm Dr. Funke Afolabi-Brown, and we are going to be talking about something that I'm very passionate about. And that is, sleep and neurodiversity, ADHD, autism, all the things that a lot of families struggle with. And so, if you've followed me for a bit, I am the founder of Restful Sleep Place and Restful Sleep MD, and we really make sleep a thing for families, for individuals. And I have an expert of experts here, Dr. Mitchell, who is a brilliant psychologist and school psychologist. So he's really worked with children. He also works with adults. And we're really going to be really exploring that topic of neurodiversity and how it impacts sleep, executive function, and a lot of the organizational skills that many families say their children are struggling with, and many individuals also struggle with. But we're going to really be getting into the weeds a bit today. So, very nice to see you and to have you on here, Dr. Mitchell. Can you introduce yourself to our people?
Sure. Yeah, and thank you very much. I just wanted to give a little shout out to a former colleague and parent in the autism world who once told me that if somebody tells you they're an expert in autism, run the other way because we just don't know enough yet. So I always kind of take that with me. So we're still trying to figure it out in the neurodiversity community. We have a good idea of some things that work and don't work, but we're always trying to update our skill sets. So I've been doing this work for decades now. I'm kind of thinking about, kind of when we started to get more serious about program development in the early 2000s, and kind of working off of my experience, my postdoc work in autism, and kind of folding that back over once we got back to Philadelphia and started developing and honing and redeveloping programs around the region.
Mm.
The need was so great at that time and still is. I think the CDC just came out with the new rates of 1 in 31, I believe, is where the autism rates are, and ADHD, I believe, is a little higher than that. Our work is cut out for us. And so with neurodiversity consultants, we're a small-ish group of consultants, many of whom are identified on the autism spectrum or in generally neurodivergent themselves. So nothing about us without us is kind of the mentality. And some are also parents or professionals that are just closely affiliated with the autism community. So a very neurodiversity affirming approach, but also utilizing the best practices at the same time, and with full kind of engagement whenever possible with the folks that we serve, so that they know exactly where we're coming from and understanding the techniques.
Yeah. I love that. Nothing like, using your own kind of coming from the lens of someone who's kind of been there and experienced it and is walking it to now make this something that you're using to impact so many lives. So thank you for that. Now, maybe we should start with just that term neurodiversity, right? Like, what does that even mean when you say someone is, neurodiverse, has a neurodiverse condition, neurodevelopmental condition? Maybe walk us through what that is and maybe what it's not, just to set some kind of basis.
Sure. Well, I think as time goes on, terms change, right, and
Yeah.
intentionally so. That there are some terms that get used in certain ways that get kind of warped in certain ways, that we need to redefine where our terminology is coming from. For autism and ADHD, they weren't really clearly defined back in the early, the mid 1900s and so on, and they certainly didn't make it into the diagnostic manuals like properly until later in the 1900s, and so we're still trying to find the proper terms to utilize to not just be politically correct, but also to be ethically and personally affirming of the folks that do identify with a particular either difference or disorder. And that's where the kind of the line has to be figured out for each individual person. At what point is this set of symptoms, whether we're talking about autism symptoms with social communication or as well as the repetitive or stereotypical behaviors, ADHD being, whether it's a subtype of hyperactivity or inattention or combined, those two categories. At what point do those symptoms become a difference? Go from a difference that we celebrate and that we kind of embrace in ourselves and those that that are in the community. And at what point does it become a disorder? That it drastically, significantly impacts a major life functioning in a way that we have to say, okay, well, this is now something that crosses over that line. And it's we're talking about going from the awareness into the acceptance and then eventually into the appreciation for those
Mm-hmm.
skills, but also those challenges, that the
Mm-hmm.
strengths and the needs is really what
Yeah.
we're talking about. And that's where we start
Yeah.
to cross over into,
And so what are some examples of these sort of neurodiverse differences or conditions, especially that you come across, you see in your practice?
so, it's usually, neurodiversity was coined in the late 90s, and it kind of
Mhm.
started popping up more in the literature and in the community in the 2000s, and then certainly started to take a little bit more, kind of gain some more steam in the last really 5 years or so, where it's become a more part of our vernacular. uh,
Mhm.
and it usually refers to folks who are autistic,
Mhm.
identify as being autistic, or some folks that identify as being ADHD, sometimes a combination of both.
Yeah.
Uh, and Occasionally you'll have folks that self-identify as neurodivergent, who maybe there's a learning difference or there's an anxiety condition or something like that that makes them feel like they're part of the community. And certainly it's a large tent. This neurodiversity
Yeah.
isn't a diagnosis; it's a way to identify oneself and those around us, that we're wired differently. That we have a little bit of something that's a bit of a different flavor, not necessarily in a bad way, but sometimes a challenging way.
Mhm.
Oftentimes in a strengths-based way that we can find solidarity in that community.
Yeah. Yeah. Yep. Yep. Okay. So mainly autism, ADHD. I know some people will consider things like dyslexia
Right.
also. Now, in terms of just when you, because again, I think just before we went on here, one of the things I say and I plead with families and say, before starting medications, you have a child who now has a diagnosis of ADHD, has a diagnosis of autism, and they're really having a lot of issues, right? It's impacting their daytime function. They're having a lot of issues with sleep. Before you even get into the medication realm, please have somebody evaluate them for any sleep disorder or insufficient sleep or poor sleep quality, whatever. Just have somebody ask questions about sleep and come up with a plan for them, whether it's testing, whether it's just providing strategies to improve their sleep. Why am I saying that? Am I right to say that?
No, I mean, you go all the way back to Maslow's hierarchy. It's like,
Yeah.
what are the basics? What do we need to address at the core of our daily functioning, if we can expect some kind of success or progress in our lives? And it really does come down to, with a lot of the folks that we work with, a good night's sleep, honestly.
Mhm.
So that's why I appreciate your work so much. That we've been able to collaborate on a couple situations where that really has been the key. Just because you're neurodivergent in some capacity doesn't necessarily mean that it has to be a grueling kind of experience day in, day out.
Yeah.
If you start the day with a restful kind of orientation, a welcoming of the day, and kind of a starting on that positive attitude, it's so hard to do that if you're fatigued and sleep deprived. Uh,
Mhm.
a lot of folks in the neurodiversity space do tend to struggle with some social relationships or connecting, with others. They do tend to use technology and screens to the nth degree, almost as a replacement for some of the daily interactions. And that exposure, as doesn't, the light kind of intruding into your brain all hours of the night, doesn't allow you a melatonin release and
Mhm.
the activation of that sleep cycle.
Mhm.
So we have this constant kind of barrage of stimuli going into the brain and then depleting our energy without even really knowing it, so that the next morning we have almost nothing left.
Mm.
We wonder why the behavioral patterns start to become a little bit more challenging. Trying to get the kid off to school. There's a lot of school refusal or tantrums or things like that that may happen in the morning. I'm not saying that all of that is due to sleep, but certainly without the sleep on board, the positive, kind of, association with sleep, it's very hard to get anything else done.
Mhm.
So,
Mhm. Yeah, absolutely. And thanks for highlighting that. So,
yeah.
why is it that so some of the symptoms, especially for ADHD, and I think even for children with autism and adults too, is that sometimes it's the difficulty with self-regulation, the impulse, some of the impulsivity, the poor executive function, like you said, some of the anxiety, things like, frequent meltdowns and tantrums and rigidity and, not being really flexible in some situations. Again, this is not everybody. This is same though. But on the flip side, I also have people who just had a bad night of sleep and they're impulsive
Mhm.
and have poor executive function and they're irritable and
Yeah.
they're rigid, and they're having tantrum, like literal meltdowns, right? Even grown-ups, right? So what is this intersection,
Mhm.
right? And do we know, or is it just that it's a continuum? Because I do have people who have relatively decent sleep and have these symptoms within that space of neurodiverse conditions too. So it's not just that, oh, sleep causes it, but there's clearly an overlap. So can you just walk us through some of that? It's something I've always just wondered about.
Yeah, and again, it's such a complex kind of array of factors to
Hmm.
boil down succinctly.
Yeah,
We also talk about, there's such variability within the neurodiversity community of
yeah.
presentations and symptoms and experiences and strengths and challenges. To boil it down and say, okay, this is the thing. That's why
Yeah.
assessment is so important, to really understand
Mm.
where that individual is coming from, what
Yeah.
their experiences, what their goals are, what their desires are, and how we're going to meet that in a reasonable way.
Hmm.
I have some folks that, I often talk about, their awareness of the world around them, which is
Hmm.
sometimes a little bit insular. We talk about, Vygotsky's zone of proximal development, the awareness that we have of what's happening around us. For some folks who are identified as neurodivergent, is very narrow. It's kind of a little bit
Hmm.
more closed in, almost from here to a screen, right?
Hmm.
And it doesn't always encompass, things like other people in our lives, or even whether the sun is up or down. Right? And so, and there's also this social avoidance or anxiety piece that
Hmm.
plays in with so many folks, that it's almost as if they find their solace, their respite at night when there's quiet and
Hmm.
there's no intrusion from a sensory overload. Things just kind of settle down. And so it's
Hmm.
healing for them in some situations to be awake at night and asleep during the day, because that's an
Yeah.
avoidance behavior. And it's
Oh,
seeking
yeah.
out peace and quiet, the respite that they so sorely desire, and they're
Mm.
missing it in the course of the day. So sometimes it's not just about, as you said, it's not just about starting with a sleep medication. It's
Yeah.
about what tools do we give people to navigate their social experience on a day-to-day basis, to be
Hmm.
aware of how much social energy they have, when that's being depleted, and what they need to do at a certain interval. When they get down to 10% of their social juices left, they're about to go into like overload.
Hmm.
How do we then give them social escapes or regeneration time, or sensory either increases in certain stimuli or decreases in certain stimuli, that they can eventually self-regulate and then be able to feel calm enough, to acquiesce to what the expectations might be in that situation, or to avoid those expectations altogether and just go and regenerate on their own.
Yeah. Yeah.
That gives them the tools so that they don't need to seek out, almost like a hamster pushing a lever over and over and over, seeking out almost incessantly that peace and quiet during the middle of the night.
Okay. Okay. Yeah. No, that makes sense. Is that, do you feel like that plays a role? Because I do have quite a number of children, even some adults too, young adults with autism, especially, not so much with ADHD,
Right.
who have this prolonged periods of wakefulness in the middle of the night. Some of them are nonverbal, some are verbal.
Mhm.
Um, and it's always a mystery to the family. Some are, some are seeking stuff, so they're wandering in the kitchen, and that tends to be very scary. But some are just content within the comfort of their bedroom, sitting in bed, just really awake, and either self-stimulating, or just really in a world of their own. Do you feel like that has a role to play with some of the things you said in terms of just seeking that quiet and that respite by themselves? Do you feel like that plays a role?
I mean, I think that there certainly are a number of situations where that does come into play. I remember a family that I worked with. Oh gosh, this is probably about 20 some odd years ago, but it's still in touch with them to this day. And they found that their child was just up at all hours,
Mm,
just really kind of just on high, right? That
mm,
energy was just so elevated. um, they needed to find a way to give him stimulation during the night.
mm,
And so they actually ended up putting a hammock in his bedroom. And they would at first, kind of almost rock him to sleep, but then he would wake up as soon as as that
yeah.
vestibular input stopped. And so they had to kind of rig up a system to make that happen. Eventually, he started to learn to kind of push off from the wall on his hammock on his own and self
Mm,
whenever he needed that vestibular stimulation. That's
mm,
ultimately kind of where we want to get to, is how do we
yeah.
get those kids who become teenagers and eventually adults to develop the tools to self-regulate and to know what works for them in the middle of the night that
Yes.
allows them to get through back to a pattern of decent sleep.
Yeah. Yeah, no, I love that. And I think that is key. And I think it's really clearly defining what the expectations are, because every child, there's such a wide spectrum, like literally and figuratively in terms of symptoms. And I think number one, figuring out, one, is there truly an organic sleep disorder? Why are they waking up? Do they have sleep apnea? A lot of these children also might have constipation. I see that in a lot of kids, but they
Mhm.
may not necessarily verbalize the discomfort of being constipated, and many times may be picky eaters. So they're not necessarily eating a bowl of spinach and chopped liver, right? So they may be low on iron or something of that sort. And or they may have reflux. So there's some medical issues. So I think that evaluation is helpful. And also that providing that counter stimulation is also been something that I have seen helped. Like, for instance, even going into the sleep period. So if they've not been outdoors much, if they've not had enough physical activity, if they've not had enough of that sort of almost like an exit or an outlet for all that sensory energy,
Mhm.
it really does impact their sleep. So physical activity is huge for kids. Spending time outdoors to really help, especially with consistent wake up times, getting them outdoors so that can reset their circadian rhythm. So there's a lot of that, which is one of the things we say, that, restful sleep does not just start with dropping into bed. It starts from when you wake up. So ensuring that you've created that environment, you've optimized their sleep environment, optimize their physical activity level. I mean, this I do not recommend, but I actually have a family that would say that child needs to go on a trampoline right before right before bed. Otherwise, they're going to be up all night. But
Yeah.
it's really finding what works for each child. As long as you rule out any medical, I would always say that medical piece is so important. And
Yeah.
so from there, really providing that counter stimulation. Some just get on, some of those sensory mats or something of that sort to get that output out. And when you mention the analogy, your client that needed sort of that hammock, it's a similar process. And create realistic expectations, right? Like, a lot of what we have defined as normal sleep
Mhm.
was really studied in typically developing, otherwise quote unquote healthy. I don't know what healthy means anymore, actually, children, populations, right? So, what does it look like for sleep, to sleep on the spectrum, right? No pun intended. What does that really look like? Well, I don't know. Do they need 9 to 11 hours of sleep if they're school age, like a child without autism does. We're not necessarily sure, but really looking at their functionality, looking at what they're doing during the periods when they're awake, looking and empowering them with the ability to self-soothe and self-regulate. I think it all just kind of comes together. And essentially, a lot of what your work does focus on optimizing their function as well during the day, because it all feeds. It's like this loop that feeds into each other.
Yeah. Yeah. I mean, I think the biggest piece of that, is to set the stage behaviorally,
Mhm. Yeah.
and kind of the feng shui, if you will, the structure of what does sleep look like? What is a good, healthy hygiene, kind of a routine that we get into? And
Mhm.
that routine, repeated over and over and over, tends to associate with better sleep patterns.
Yeah.
There are some, families who, they don't have necessarily those routines. But for the purposes of neurodivergent kids who need that
Structure.
they need to know what to anticipate. They need to know what the
Yeah.
expectation is. Setting that stage, sometimes there's a sensory kind of environment, and we talk about
Mhm.
T's are great at this, occupational therapists, in kind of identifying, okay, well, do we need more olfactory stimulation? Do we need less light?
Yeah.
Do we need more light? Do we need vibration? Do we need this? Do we all these pieces
Yeah.
of sensory experience
Yeah.
form the almost a cocoon around that child, or,
Mm.
or adult for that matter, and be much more intentional about setting that piece. This is, I think, streaming live and in late May, so we're just getting toward the summer solstice. I always talk about, to families, this is the perfect time of year to reset the sleep schedule, because we have really about 8-9 hours of darkness, right, which is about what you want for the goal for sleep, whether it's a neurodivergent kid or a typically developing kid. This is the time of year to, I hate to say it, take the curtains down. Right, so the sun is up, we get the sunlight, the sun goes down, it's time to sleep. And then we develop those routines during the summer months to be able to reset that sleep schedule, so that when we go back to school in the fall, now we've developed a behavior repertoire. We know all the things that are associated with sleep. We have the eucalyptus drops on the pillow, and we have the gentle breeze of the fan that gives the air movement, and maybe there's a vibrating pad under the bed that just, or between the mattresses, just gives a little bit of sensory stimulation. Maybe there's a pattern of white noise that's playing in the background on a looping YouTube video or track or something. um, all of these little tools to set the stage become part of that long-term sleep habit, eventually turning into the person's self-regulation of those patterns as well. So,
I love that. I love that. And one of the things you said is working with an occupational therapist. Oh, this is so key. So you're not guessing. They can help you sort of figure out what type of counter stimulation does your child need. So, like you said, whether it's auditory, whether it's sensory, whether it's vibratory, you can kind of figure that out, and you can sort of project that into sleep. I love the routines piece. So there's various things that cue our brains that it's time for sleep. One of the biggest is what we call light. It's called the Zeitgeber, right? It regulates our circadian rhythm, very tightly regulated. So taking advantage of early morning light, especially for kids that have a hard time getting up in the morning, is very important. And then one of the other things you said is just the power of routines. It seems very like, oh, come on, routines. Here you go again with routines. It is so fundamental. It is fundamental. Like, it is so critical. And you do it over and over. So the child knows what to anticipate. It's not guesswork. And they might fight it, but you create those boundaries by helping them know, okay, after this is this, and after that is that. And many of these kids sometimes will have them use a bedtime chart. So bedtime routine chart is perfect. So they are checking off exactly what step they are in the routine. Again, it helps to reinforce and really prevents the likelihood of such very long, convoluted, and complex bedtime. So I think all of that is very, very important. And one of the things that I know you help a lot of your clients with is just really managing that executive function. So the reason why, and this is how we met, we had a patient. I had a patient who, you know, pretty amazing, very bright young lady with, with ADHD and some sleep issues. And one of the things she just could not do is organize herself enough to make it into bed in time. And it was really around like procrastinating and pushing things off and have some avoidance and screens, and it was all of that. She knew cognitively what she needed to do. This is the thing, and but the ability to get it done was just such a struggle. And this is where I really needed someone to help with sort of that executive function coaching. I did some of the coaching on my own, but I felt like, okay, you need to listen to someone else's voice a little bit, and then we'll continue to work on your sleep. So maybe shed some light on what that looks like with managing executive function, because the same way it can impact their sleep, it impacts, their basic day-to-day life.
Yeah. And, and when we talk about executive functions, we talk about, many, specific kind of, skills that we develop over time, but, it comes down to emotional and behavioral self-regulation. And that, and part of that, I think it starts with first the awareness, the acceptance. In DBT we talk about radical acceptance of oneself and your differences. That recognizing that I'm not really good at that planning thing, or that self, kind of initiating and following through and kind of monitoring myself. I'm not good at this. I need some structure. I need some help. I need a routine. I need tools sometimes, whether it's, the executive functioning, in the form of a parent, saying you need to do X, Y, Z, and no kid wants to hear that, or to get to the point where they can self-regulate and say, this is part of who I am, and I need to be able to take care of these routines in a very predictable, systematic way. If we get to that level of self-awareness and acceptance, the real acceptance of ourselves, then those patterns that we put into place start to become a little bit more effective. I know we work with college students as well. I think I referred somebody over to you recently who his sleep pattern it flips like from season to season, week to week. It's nocturnal, it's diurnal, it's like, where are we? And part of it is like, well, if I'm going to be productive at 9 p.m., I can't stop until I finish. And that might be 5 a.m. And there's a fear of missing out, or fear of losing an opportunity, a FOMO kind of mentality that kicks in. We have to nip that early in the bud to be able to say, okay, there's more benefit in going to sleep at a regular time. And then I will build in my blocks, my intervals, starting at 9 a.m. in the morning, using kind of a Pomodoro method, or a series of work intervals and break intervals that works, a ratio that works for that person, to be specifically kind of scheduled in, blocked in at certain times of the day to be productive. School age kids tend to have a little bit more of that structure implanted for them. When you get to college, and certainly through adulthood, it's kind of up to you, right? There's about half as much time in college spent in class versus in high school. The rest of it is just assumed to be self-regulated and productive time that professors just anticipate you're going to be able to manage. All of our folks can do that on their own. They need that constant structure in place, and they need to be able to buy into a system that works for them, even if they need a little bit of support from an executive functioning coach of some kind.
Yeah, I love that. I love all of that. And one of the things you said, which is a big one, because with neurodiverse conditions too, autism, ADHD, all of that, there is a tendency towards kind of being a night owl. We call that delayed sleep phase syndrome. It's actually something we've seen with a lot of our families. So we end up using some light therapy. Sometimes we'll do melatonin. We just kind of have to strategize. And what that ends up doing is, if they get the opportunity, if you have a child in college who is able to maybe start classes late, okay, it's still a bit of a struggle, but they don't start classes till 12 noon or 1 p.m. It's all good. But when you get into the outside world, where you have to wake up, or you have a job, or you have a class that's early. It's hard if you're not going to bed until 2 a.m. and you have to wake up by 7
Yeah.
or 6 a.m. to start school, or like for our high school kids, right? So there's that awareness, and that's such a powerful thing you just shared. That awareness of, well, this seems to be the way I'm wired in a world that is not necessarily
Yeah.
flowing with my sleep schedule. So how do I, understanding how I'm wired, how do I still thrive where I'm now not burning the candle on both ends? How do I make sure that some of that incredible energy that surges at 11 or 12 midnight, how do I kind of dissipate it? And this is through structure and having some kind of built-in structure. And there's so many strategies. I think is really what you said, finding what works for you, in such a way that you're not constantly playing catch up and you're not constantly running on empty. So I think that is really, really powerful. And you're right. Earlier on in life, it might be easy if you have parents who are able to, or mentors who are able to kind of help you with that rigid kind of structure. But as our kids get older, they need to start to learn those things, because they're going to be in a world where people just assume they know those, or have those skills.
And
Really,
it may not be, the world isn't necessarily fair in that
no,
respect. It would
no,
be wonderful, for us to have enough tolerance and acceptance and
yeah,
appreciation for neurodivergent differences.
yeah,
Um, I don't think we're there yet. We
no,
have a lot of work to do as a society to really embrace those differences. And
yeah,
until that time, there's an expectation that people are going to need to show up to class, work,
yeah,
etc., in order to be part of a functional society.
yeah,
Um, it's not fair, but it is real. And therein
yeah,
lies the dichotomy, the crux of
yeah.
our conflict there sometimes.
Yeah, no. Well, this has been incredible. I feel like I have so many questions coming up. I'm just going to hold back and,
Sure.
maintain some self-control. So we definitely need to have you back to talk through some of these, like actual in-depth strategies as well. But it's been just such a joy to have you. Can you tell us where people can find you? If people want to work with you, learn more about the work you do, especially with schools and, students and young adults and things like that.
Sure. Yeah, I'm not sure if it pops up here. Oh, there it is. The neurodiversityconsultants.com is the website. And we work directly with families and schools, as well as folks all the way through the age range. So we have, some retired folks who are starting to sometimes just identify for the first time that they're neurodivergent. And so, there's that process at the end. There's also, on the flip side, the initial identification and the assessment on the front end, whether it's kids that are 2 years of age, some, all the way up through, their high school years and so on, in preparation for that transition to adulthood is the next kind of big evaluation point. So we can kind of take a look and see where we are and work with folks accordingly. So
Awesome. Awesome. Thank you so much. So we put it out here. We'll also put it in the notes and all of that. So it's neurodiversityconsultants.com. It has been just such a pleasure. Now, if you are out there, we've talked about a lot of things. So if you have, neurodiverse condition, if you identify as having either ADHD or autism or dyslexia or anything like that, there is help. There is hope. Things don't have to feel chaotic. Sleep doesn't have to feel very ragged and just exhausting. If you have a child who's struggling as well, this is really where you can give them the right support. So definitely check out Dr. Mitchell's website. And if you have sleep specific questions, you know where to find us. We're at therestfulsleepplace.com. We are so passionate. That's one of my passions, especially with folks who are growing or developing differently. It doesn't necessarily mean a bad thing, but how do we optimize your sleep, your family sleep, so that everyone can thrive? So feel free to check out our website at therestfulsleepplace.com.
great.
Awesome, awesome. This has been great. Thank you so much. I really appreciate you coming on here. And everyone, until next time, I hope you rest well.
Take care, everybody.